Good evening. Our first topic today is just the now regular update on the run chart that we've been using to track new COVID-19 cases in Canberra. The reason I'm doing this is just to show you how we work with the run chart, how it develops over time. Now, what you see here is an update. This brings us up to this morning's numbers, and you'll see if you look at that things have look like they've started to go down again, but we still have a significant shift upwards. That red dashed line there is the upper fence, so compared to our baseline, which was over here, we're well and truly shifted up. Now, what we would do in this situation very likely is we would decide, okay, we need to set a new baseline, particularly now that Canberra has moved out of lockdown. So the move out of lockdown commenced on Friday, and the predictions of the health authorities are that case numbers will probably start to go up again, perhaps quite significantly, even though Canberra has achieved an extremely high vaccination rate, on target to be one of the most, perhaps the most highly vaccinated city in the world. So what I've done in the second chart here, I just move down. So what I've done here is I've set a new baseline. So the new baseline is now, it's basically the first 2 weeks of October. And by setting a new baseline, I've set a new control line. So the old control line was at 16. This one I think is at 35.5. And I've also calculated a new upper fence, which is pretty high. I think it's at what is it? It's about 60 something, 67 or something like that. So pretty high upper fence. So we only have 4 days data here after this new baseline, so we don't have enough data yet to be running a shift or a crossings test. We may have enough by next week. So what will be interesting to see is whether we get a significant shift upwards as the health authorities are predicting. We'll just keep tracking it and see what happens there. Now, as I've said a few times in class, the thing to remember when you're looking at this is you always have to be thinking against the background of what kind of process are you tracking with the run chart. And what we're tracking is a pandemic. And the nature of pandemics is left unchecked, they grow exponentially. And if exponential growth on this chart, if we go back to the start here of the lockdown, it would look something like that. I mean, it really would be off the scale. So what you're seeing when you look at this run chart, if you compare it, is you see this is actually, compared to what it could be, it's being very well contained, even though there are some significant shifts. But many other processes that we deal with don't have that exponential growth characteristic. So that's less of an issue. But it's always important to understand understand the underlying process that you're trying to monitor with the run chart. Okay, that I think will do for that topic. And the next thing I'm going to talk about is I'm going to go over this question that I left hanging at the end of the last lecture, and I asked you to have a go at solving it, and I'll work through the calculations with you.